Have you ever wondered why diabetes, especially type 2, has become increasingly common among young people today? It seems like an anomaly, right? But the truth is, we're witnessing a rising tide of diabetes in youth, a wave that's grown alarmingly over the years. Let's dive into the numbers. In the past, we mostly saw type 2 diabetes in adults, but today, the age at which people are diagnosed is dropping. The Centers for Disease Control and Prevention reports that every year, more than 5,000 youths are diagnosed with type 2 diabetes. That's an increase of about 4.5% each year since the turn of the millennium. Yes, you heard that right, 4.5% each year. Now, what's causing this surge? There's no single answer, but rather a combination of factors. A significant one is the shift in lifestyle. Today's young people are more sedentary than ever before. The advent of technology has them glued to screens, leading to less physical activity. And you know what they say, a body at rest tends to stay at rest, especially when it's accompanied by unhealthy eating habits. Which brings us to the next point: diet. Fast food consumption has skyrocketed, and the love for processed, sugary foods is at an all-time high. This unhealthy diet is like a welcome mat for diabetes, inviting it right in. And let's not forget genetics. If a family history of diabetes exists, the likelihood of a child developing the disease increases. The dice, it seems, are loaded from the start. Years ago, it was rare to hear about a young person being diagnosed with type 2 diabetes, but today it's sadly becoming the norm. This rising tide of diabetes among our youth is more than a health concern. It's a clarion call for us to reassess our lifestyles and priorities for the sake of our children's future. Comparing the prevalence of diabetes in young people today with that of years ago paints a startling picture. In the past, diabetes was considered a disease that primarily affected adults, particularly those in the later stages of life. However, in the last few decades, there has been a significant shift. Today, an increasing number of young people, including children and adolescents, are being diagnosed with this condition. The numbers alone are disconcerting. In the mid-20th century, the incidence of type 2 diabetes in children was almost unheard of. Now it's become a public health concern that cannot be ignored. So, what has changed over the years? If we delve into the societal and environmental factors, we can identify several culprits. A rise in sedentary lifestyles, changes in diet, and an increase in childhood obesity are all factors that have contributed to this surge. Our society has, in many ways, transitioned from one of physical activity and home-cooked meals to one of screen time and processed foods. These shifts in lifestyle and diet have played a significant role in the rise of diabetes in young people. But it's not all doom and gloom. The silver lining here is that type 2 diabetes is largely preventable. By promoting healthy habits such as regular physical activity, balanced nutrition, and maintaining a healthy weight, we can combat this upward trend. Awareness is also a crucial part of this battle. The more we know about the risk factors and early signs of diabetes, the better equipped we are to prevent it. Organizations, schools, and even families can play a pivotal role in spreading this awareness and fostering an environment that encourages healthy choices. In essence, the surge in diabetes among young people is not just a medical issue, but a societal one. It's a clear sign that our approach to health and wellness needs a revamp. The stark contrast between the past and present prevalence of diabetes in young people underscores the urgent need for action. We've covered a lot of ground today, so let's quickly recap the main points. We've seen how diabetes prevalence in youth is surging, a stark contrast to previous years. This increase is not a random event, but rather a result of numerous factors, such as sedentary lifestyles, unhealthy diets, and genetic predisposition. These elements work in tandem, creating a perfect storm for diabetes to thrive. Understanding the reasons behind the rising prevalence of diabetes among young people is the first step towards reversing this trend. Now that we understand the problem, it's time to take action. We can all play a part in preventing diabetes by adopting healthier lifestyle choices. Opt for a balanced diet, engage in regular physical activity, and ensure adequate sleep. It's not just about safeguarding our health, but also about equipping ourselves with the knowledge to support others. So share this video, spread the word about this escalating issue. Together, we can make a difference in the fight against diabetes among young people. Thank you for watching.